What's going on, guys? Dr. Greg here with Movement Driven Performance Physiotherapy. Today we're going to talk about knee pain, specifically anterior knee pain. So this is one of the most common things I see in the clinic is pain kind of underneath that kneecap or behind that kneecap, underneath it in the patellar tendon, on top in the quad tendon, kind of any of the pain right in the front of the knee. And that's a little bit different than what we would classify as a meniscus or ACL sprain or arthritis in the main part of that hinge joint. It's a separate joint called your patellofemoral joint where your kneecap, your patella, meets with your femur and has to glide up and down as we bend and extend our knee in squats, in jumping, in running, in walking, in stairs. Basically anything we do with the knee, we have to have that joint as well as the major joint functioning well. There's three major things that I see very commonly with my patients with this kind of knee pain. So we're going to talk about if you have those things, what they are, why they contribute to knee pain. And then the videos below in this blog post will have some guidance on what you can do to start to help yourself get out of the pain and get yourself, enjoying the activities you love to do again. So let's talk about those three things. So the first one is quad and hip flexor tightness. So one of our quad muscles, so quad meaning four, we have four quad muscles. The one on top, called your rectus femoris, starts above the hip joint, comes down, and actually encapsulates the kneecap and turns into our patellar tendon, inserting on that shin bone, the top of the tibia. What's important to know about this is that because it encapsulates that kneecap, if there's some tightness along that chain of that muscle, then that's going to further increase compression and drive that kneecap into the femur more because there's more tension built up and it's not able to move and glide the way that we need it to. Because it's a hip flexor as well as a knee extensor, so hip flexor meaning flexing the hip, knee extensor meaning extending out, that specific rectus femoris muscle that encapsulates the kneecap has two functions, hip flexion and knee extension. So if your hip flexors or your hip flexor portion of that muscle happens to be tight, that again will increase tension down. So I always check hip flexion and quad flexibility, and those two things tend to be tight in a lot of the patients dealing with anterior knee pain. The second thing that I see a lot is a problem with ankle mobility, specifically dorsiflexion. So dorsiflexion has to do when our toes come towards our nose. And that is obviously very important when we're talking about going downstairs or squatting, jumping. We need a good amount of that motion. What I see a lot of the time is when we have limited dorsiflexion, we tend to overload the balls of the feet when we're doing those movement patterns. So even if my heel doesn't come up off the ground, if I lean forward and get excessive weight distributed through the ball of my foot, that's going to create increased force through that kneecap area. Now I'm okay with the toes going past. I almost want them to go past the toes, but I also need the butt to be able to go back and not be riding this way with my butt closer to over my heels. When I go here, if I'm having knee pain, I'm gonna feel more stress and more pain. So I need to have the appropriate ankle mobility, dorsiflexion, to be able to really load the heel while my knees move forward. And then that kind of turns on the glutes a little bit better and stops allowing the quad from overworking. So that brings us to our third most important thing. It's glute function. So a lot of times I get people with anterior knee pain and they have weak glutes, but they're like, but I squat, I deadlift. That's great. Keep doing that. However, if we lose the ability to coordinate between our brain and our glute and fire that muscle automatically, fire that muscle efficiently, then that muscle, especially when loaded heavier out in the weight room or with jumping or the activities you love to do, that muscle's not functioning to the level that we need it to, which then puts more stress on the quad. The quad has to pick up the slack of the glute, which creates more tension, which then creates more pain in the front of the knee. So glute max strength with those squatting, jumping type movement patterns is paramount, but sometimes we have to regress it and do types of exercises that will contract that muscle in isolation from what I call motor control standpoint, or create a better muscle memory of your brain and the muscle communicating again, and then lead that back into higher level dynamic exercises like a squat, where their glute can then do its part and the quad cannot be overworked as much. The other muscle, not just our glute max muscle that we were just talking about, but our glute medius muscle on the side here, is super important to be able to decrease stress to that knee joint as well. If that muscle starts to get lazy, then our knees tend to cave in and we put more stress to the inside of that knee, of that patellofemoral joint and the knee joint itself, because there's increased torsion and stress going through that area. When I was in grad school, I read a study about where they had two groups of patients with anterior knee pain. Group A did quad strengthening and glute strengthening. Group B did just glute strengthening. Both groups improved their pain levels to the same degree. So it shows you how much we need to focus on glute strengthening, not just strengthening around that local problem. The problem is usually somewhere above or below, like we talked about with the glutes being weak, the hip flexor being tight, the ankles being tight. That's all kind of meeting in the middle and causing some of that knee pain we're dealing with. So you may not have all of these impairments. You may have some of them. You may have most of them. You may have all of them. Try out the videos below in this blog post with some solutions on how to address some of these issues and see if you start to improve your pain over the next few weeks. Be consistent, and I promise you, you'll start to feel better. If you're in the St. John's or Jacksonville area, come and see us. We deal with this all day long, every week. We see hundreds of patients with knee pain routinely, and we can help you get better. There's no reason why you're in pain doing the activities that you love to do. So try these out. If you're not getting as much success as you'd hoped, give us a call, come on in, let's get you feeling better.